Hi, everyone. My name's Kathleen. I work for the World Parkinson Coalition. I'm in the office today, hence the mask. I just wanted to touch on a couple of logistical things before we get started. Everyone who is a participant will be muted for the duration of this meeting. If you do want to ask a question to our panelists, you can use the chat feature below. They'll be answering some questions in chat and answering some questions out loud, depending on the nature of the question. This session is being recorded, so if you want to watch it again or know someone who wasn't able to attend live, we'll be sending that out after the meeting. So with that said, I'd like to introduce the Executive Director of the World Parkinson Coalition, Eli Pollard.
Hi, everyone. It's nice to see some of you and see names and also some photos. I am Eli, the Executive Director at the World Parkinson Coalition, and I am very excited to have our partner highlight session this month look at our longtime organizational partner and colleagues at the Parkinson's UK. And there are a handful of them we're going to be presenting for us today, which is wonderful. I first met, I think I first met Steve Ford in around 2007, shortly after he took over as in the role that he's in at the Parkinson's UK. And I have to say the evolution of the work that the Parkinson's UK has done since that time has been really impressive. Constantly innovating, doing very forward-thinking things around research and care. And I think some of us are a little envious of all the things Parkinson's UK gets to do with the national healthcare system and a really tight-knit community, as well as their Parkinson's disease nurse specialists. Some really wonderful things are being done across the UK. And we have this opportunity today to hear directly from the team at Parkinson's UK about a new program, a new support system. I want to make sure I say it correctly. They'll talk about it more in detail, called Parkinson Connect. And again, it's just thinking about how do we best serve people with Parkinson's from the day of diagnosis and make sure they get the resources they need. So I think there's a lot of opportunity to learn from what Parkinson's UK is doing. And I hope that those of you on the call who are connected with organizations in your own communities will take good notes and see if there are things you can start implementing in your own countries or states so you can also better serve people with Parkinson's. So with that, I'm going to turn over to Steve and let him introduce his team and get us going with the discussion. Thanks, Steve.
Brilliant. Thanks, Eli. And yeah, I mean, yes, it was 2007. And I think for many of us, we've been involved with the Parkinson's community, working with the Parkinson's community for a long time. And probably we've all had thousands of conversations where people tell us what it was like to be diagnosed. Often that's a really negative experience that people talk about. Sometimes it's a really positive experience, and that seems to set people up really well for knowing how to be supported and perhaps to be more in control of living with Parkinson's. So it's always been a real priority for me to think through how can we routinely connect with everybody that's being diagnosed with Parkinson's. How can we provide people with a proactive, personalized service? And it has been fantastic that over the last couple of years, we've been able to really move forward with that goal. We've invested some significant resources and starting to make some real progress with a fantastic team taking this forward. So really excited to be able to share, what is still work in progress with you. And it would be great to get some feedback from this as it works through. So I'm going to shut up in a minute and hand you over to Katherine Crawford. Katherine is our Director of Services within the charity, so she leads all of this work, and she'll be supported by Yvette. Yvette is a member of the Parkinson's Connect team, the Connect project team. She lives with Parkinson's, and her role is to make sure that the voice of people with Parkinson's is shaping everything that we do. And then available kind of on the panel, and I hope you'll have lots of questions for them, Polly Cook, who's really the kind of brains behind all of this, who is just a fantastic transformation, modernization lead around all of this, and has really helped us to think through our kind of approach and methodology. And then delighted to be able to introduce Dr. Annette Hand. Annette is a consultant nurse in Parkinson's. She leads, she's our lead nurse within the Excellence Network, and is a real lead clinician in the UK, and she's been involved in the project and has got some experience to talk about as well. So that's all from me. I will kind of moderate the discussion at the end, so keep your questions flowing on chat, and look forward to the discussion. But let me hand over first of all to Katherine.
Fantastic. We came on the call early to make sure there were no technical hitches, and then there was one. But great, Steve. Thanks so much for that really fantastic introduction to Parkinson's Connect, and give some hint of why it matters to us here in the UK. And I know being privileged to be part of the newly diagnosed working group that's preparing for WPC 2022, that issues around diagnosis are really hot for everybody across the Parkinson's community. For us at Parkinson's UK, though, our information and support service stretches beyond diagnosis and right through the Parkinson's journey. And we're really privileged because we've been in a position to be able to offer some kind of support to people living with Parkinson's over many years, and to build our service across that team, in part due to Steve's leadership and to being able to fund and build those connections in and out of the NHS that Annette's talked to. In fact, that's where I started my own career with the charity a long time ago now, 17 years ago, right rooted in that support service. So for me, this service transformation project is absolutely close to my heart. So I'm really proud to be able to talk to you all about it and share some of the things that we're learning along the way. So what is Parkinson's Connect? It's a great couple of buzzwords. Well, Parkinson's, we know what that is. Connect, what does it mean for people living with Parkinson's? For us, it's our new service pathway for people living with Parkinson's, crucially for their family, friends and carers too, from that point of diagnosis onwards, right through their journey. We already provide information and support to around 50,000 people living with Parkinson's and that wider network a year, through our helpline, through our online community, through a forum, through our print resources, and through our advisor services. However, we know there's a growing number of people being diagnosed with Parkinson's every year. We think that'll be up to over 140,000 per year in the UK alone, not to mention worldwide. So we really understand and know that we have got to scale our information and support service to be able to reach everybody in the way that we want to. So we've undertaken what is for us a hugely ambitious service transformation program. The way we're approaching it is radical and pioneering for us. And for me, leading our work to provide services, one of the really ambitious parts about it is, as we're doing it, we're delivering our existing service alongside. So that's involving a lot of incremental change, building culture change, building operational change within the way that we're working. So there's a lot going on at Parkinson's UK as we keep the front shop open, and as we're responding to people's real needs in what's a really incredibly tough time, any time for someone with Parkinson's, and of course, particularly more so now. So what's helping us to make this change happen? We are really privileged to be working alongside a really skilled multidisciplinary team, working alongside people living with Parkinson's, their families and friends, and hang on to that thought, because we'll be talking about it more through the presentation. We've already spent 16 months researching, designing and testing new products and services. And because of COVID, we did a great big pivot in 2020, and we have learned so much from that. So looking forward to sharing a little more of that with you too. We've got tested and developed iterated prototypes ready for action. And now we're in a position where we're on the cusp of really seriously defining Parkinson's Connect as the charity's new information and support service. So we're in it's a good place and time to talk to us. We've tested stuff, we've proved it worked, and we're just on the verge of upscaling some of that work. What's really crucial for us, and Eli touched on it in her introduction, is our unique relationship with the health and social care. the NHS is known throughout the world for good and bad, but I would say for all the ups and downs, we are really privileged to be citizens in the UK where we have an NHS that is free for everybody at the point of use. It is fantastic, genuinely is. We've worked alongside the NHS for many years, encouraging, nurturing the development of state-funded Parkinson's health services. And through that work, we've established the nurse specialist service right around the UK. So we know that that influencing work is effective. There are thousands of professionals, not just nurses, supporting people with Parkinson's throughout the UK, and it's their passion and commitment that's driven up that standard of care over many years. But we know we've got a lot more to do. So in 2014, Parkinson's UK came together with the professional community to launch the UK Parkinson's Excellence Network. People affected by Parkinson's and health professionals working together through our sort of leverage and sort of ability to be that bridge to build better practice. Our clinicians take up charity-funded resources, including our extensive education resources, and we share and learn from clinical tools. And over 600 UK Parkinson's services voluntarily audit their work and hold their hands up and work to improve their services every 2 years, which is brilliant. What a commitment. This work's driven by the network's clinical leads and Dr. Annette Hand, who Steve's introduced as part of our panel this evening. And this team's now working with us to champion, nurture and support the development of Parkinson's Connect. So we're in a good starting block. But why do we need to change? We're already serving around 50,000 people a year, as I've talked about, through our face-to-face service, through our helpline, through our website, through our downloadable resources. 35,000 people viewed our newly diagnosed pages last year alone. But despite our best efforts, we're not there for everybody that currently needs us. And we recognise we're unable to exist those existing support service to meet the increasing demand that we know is going to be there in the future. Unless we change the way we do things now, more and more people affected by Parkinson's won't get the support they need. And we can't always connect people to the right opportunities for them, including those vital opportunities to get involved in research. We've done a lot of research fairly intensively, and we've identified that that diagnostic point is a key time to connect with people. Diagnosis is often a prolonged, anxious and lonely process. I don't need to dwell on that. We all know it. Little relevant information provided by healthcare professionals can augment that, and it's not always easy for healthcare professionals to keep our information at their fingertips or make those referrals easily. We're determined to achieve this and to change this and achieve our goal of connecting with 80% of people. It would be fantastic if it was 100, but we've got to have some point of realism at that point of diagnosis by 2024. So how are we going to do this? What is our ambition? It's in 6 parts. We want to be confident that every single person diagnosed is connected to Parkinson's UK from the point that they're diagnosed. We want to be confident our services are there for people who use digital technology and for people who use phone and paper-based support. We want to improve our support for people living with more advanced or complex Parkinson's. It's got to be quick, rapid and effective, and increase our support so that people access the support they're entitled to. We are living in a rights-based culture in the UK, and our role is to champion and make sure that people with Parkinson's are positioned in the right place for that. We know it's a worldwide rhetoric. Everyone with Parkinson's is different and lives in different circumstances. Our offer needs to suit everyone, be personalised. Otherwise, people won't bother taking it up. Why would they? And people need to have the right information so that they themselves are truly empowered to live well. This will include developing our advocacy work so people can access those rights effectively. And finally, and really importantly, we want to have a really clear defined offer for family, friends and carers. It's a big ambition, but we're going for it. We're taking a really pioneering approach, and this is where Polly comes in, so I know she'll be looking forward to take your questions. We wanted to make sure we were setting up this project in the right way, breaking down silos and ensuring true collaborative work together. So to do this, we brought together a cross-functional team from right across the charity. We've got a core service design team with experts in design, digital, data, content, user involvement, that's Yvette's role, and seconding in people too from our frontline service delivery teams, bringing in their knowledge and expertise. And this team works right alongside people living with Parkinson's to design this service pathway. Alongside that, we've got a core operational model team, the nuts and bolts, the people that tell us what we can and can't achieve, a group of senior consultants from across the charity that will ensure everything we're doing is feasible and crucially scalable. It's not a charity pipe dream, this, it's got to work. This team has been working together for 16 months. They work at pace and are driven by the needs of people living with Parkinson's and their friends and families and carers. This has really been pioneering for us as a charity. We've really drawn from the agile approach that we hear so much of in the tech sector in particular. And for me, with my roots in service delivery and working with people living with Parkinson's and doing that support work, I have learned so much from experts like Polly. This method has really proved its work when the pandemic hit in 2020. We were able to use the team's skills and resources to replan and design the way that our existing service was delivery and to produce new information really quickly because of the process. We have learned so much about how to work this so well in this way and how to be brave when something's not working well, to test, to develop, to move on or stop if we have to. I was talking to Steve about it yesterday, and I was saying, genuinely, I do not think without Parkinson's Connect, we could have supported 50,000 people in 2020 when they were desperate. So it's been really good for us for that point alone. And I know from that we can build to do so much more. We've talked quite a lot already about working with people living with Parkinson's. I can't emphasize enough how important this is to us. For many of you on the call, the UK will seem like a titchy, tiny little country, but we have a really diverse population. We're urban, we're rural, where I live is pretty rural, we're ethnically diverse, and we've got a really strong sense of local cultural identities. We're made up of 4 nations, and even within those nations, each area has its differences. But we could design the best system in the world, but if it's not going to work for people with Parkinson's, wherever they are and whatever their circumstances, it's no use. It's got to work for everybody. And that is why we have our co-design panel of people with Parkinson's and their families as an extended part of our team. And Yvette and colleagues have worked so hard to bring in people from some of the most underserved communities in the UK to be part of that co-design panel. I'm really looking forward to see where we go next with it. Parkinson's Connect has got to be there for people from the point of diagnosis. Our plan is to have a new referral tool embedded into the NHS, and when a healthcare professional diagnoses somebody, they're going to have an automated, simple process to directly refer that patient to Parkinson's UK. We've already been testing this, and Annette and her colleagues have been doing a fantastic job up in the northeast of England to do that, and they've told us it's working well. What they don't know, don't tell Annette, is that behind the scenes, we're doing it all by hand. The next step is to properly automate it with the right tech support in place. We'll then reach out to people with Parkinson's. If they're online, it's going to be through a sophisticated, tailored account platform, and it's a big source of investment for us in 2021. And that account platform will be personalized to them. So if you're me, a woman in her 50s, you'll get one set of content. If you're Steve, a very young man in your late teens, you're going to get an entirely different set of content. And if you're not keen on being online, we'll be reaching out via phone or by print. People will also be able to speak to one of our advisors at any point or join a forum, and we'll be able to provide that intensive support to those who need it. Condition, about the importance of exercise, for instance, or making those connections. And people can access those when they suit them. And ultimately, our ambition is that everyone's got the opportunity to attend a local event so they can meet people in their own areas. Sounds great. We've just got to make it work. Throughout our research, we identified a number of different things people wanted support with to help them live well with Parkinson's, more guidance on future planning, on having difficult conversations or navigating their rights. And we've designed products around each of these areas. We'll be introducing video calls into our service offers. They're not for everyone, but they're for people who want it. And crucially, and this is a step change for us, many people told us at moments they were struggling or times they felt things were spiraling out of control, people felt they were at their least likely to reach out for support. I don't think that's Parkinson specific. It happens in all walks of life, doesn't it? But for us, it's important that we are there and we can reach out to people at that point if they want us to. So we've designed a proactive check-in. We've never done this before, where we phone people. We tested it in the coronavirus response, and we have attracted lots of new people to our service. People most in need, actually, who've never used it before. So we're looking forward very much to extending that. And when life gets tougher for people, we're still going to be there. When people are managing more severe symptoms, we'll provide more intensive support, helping people navigate those difficult decisions and complex challenges. And we know how urgent that can be. So we've got to design our system that people don't have to wait. We're right there side by side. I know that from my own experience as a support worker. I hope these slides have given you a sense of the vision and scale of the service transformation we're pioneering and our determination to achieve success. One of the most crucial elements in this project is the way that we work with people affected by Parkinson's. And it's my pleasure now to introduce my colleague Yvette, whose specialism is in this area. Yvette, over to you.
Thanks, Katherine. Yes, so my name's Yvette and I was diagnosed at the age of 47. I'm a single mum to Harvey, who's at university at the moment. It's my job in the team to make sure that we involve people with Parkinson's as we design Parkinson's Connect, and it works for everyone at every stage of their journey. So when I was diagnosed, my experience of diagnosis was not great. After several years of going back and forth to my GP, 2 MRI scans and a DAT scan, I got a formal diagnosis. But the diagnosis unfortunately came by letter, and the slide shows what was written on the letter, which I really couldn't, it was neurology speak, and I couldn't understand what it was. I had no idea about what Parkinson's was. I thought it was just an old people's disease, people who've got a tremor. I actually Googled a lot of these words and then Googled advanced Parkinson's. So at that point I thought, well, how long have I got? Will I die from this? And then one of the questions my son asked me was, Mum, will I get it? And I didn't know the answer. So that's not everyone's experience, but that was mine. And I feel very passionate about Parkinson's Connect because it changes everything for people in the future. And I feel very honoured to be part of the team that's delivering that. So I wanted to pull out a couple of things that would have helped me at the point of diagnosis. And the very first one would have been having some kind of connection. I was left with 4 weeks before I actually saw anybody, a Parkinson's nurse, and basically it was take these pills, come back in 6 months. And when I saw my neurologist, he said, you don't look like you've got Parkinson's disease. Because I didn't have the classic tremor, and obviously I was a bit younger. So if I could have spoken to somebody at the point of diagnosis, it would have stopped me worrying so much about the future and realised there are medications that can help deal with the condition. And also the things that I could do to take charge of my own self-care through exercise and diet and things like that. The other thing that would have helped, the second thing, was checking in on me to see if I was doing okay, because I think with depression and isolation, people with Parkinson's tend to withdraw. Our researchers also said that people might not want to know about the future, but just to have knowing that somebody's going to be there, or being able to ask somebody these things, would have been really, really helpful, especially around things like mental health and exercise. The third thing that would have been incredible for me would have been around quality content that would help me, day to day. So information about medications, what options are available to me, alternative therapies, managing depression, and also going back to work, because at that point I felt that I wouldn't work again. I couldn't do my buttons up. I was really struggling with a teenage son at the time as well. So having that quality information that's tailored to me would have been absolutely brilliant. But I didn't get that experience, but Parkinson's Connect will actually change that. So really, I think, as Katherine said, everyone's story is different, and we're like snowflakes. Everyone's symptoms, characteristics of Parkinson's are very different. And what we have done is we've interviewed and researched people, finding out what their needs are, also tested some products as we've been developing them along the lines. This is not just about digital transformation either. It's been designed with the user at the heart of what we do. So it's flexible, it can change, as Katherine said, to cater for things like coronavirus or changes within the journey of Parkinson's, because it's not linear, it's up and down. And the support that we're going to be providing takes account of that. It's personalised, it'll be available in different ways, by phone, online, in person. But very importantly, it's going to empower people to manage their own health and self-care through self-serve. And as we know, education is medicine and knowledge. The other thing that I think is quite important is that it's going to be available to loved ones, family and friends, because Parkinson's is not just, it affects the whole family. So that's quite an innovative approach, that information will be specifically tailored for those people. So in a nutshell, this service is so much better than Googling advanced Parkinson's on Google. It's going to hopefully revolutionise the support and information that people are going to get at that point of diagnosis and throughout their journey. So we're going to make sure that happens through more user research, testing, and co-designing every product that we develop. And I feel very proud to be part of this. So thank you for listening to me, and I'm really looking forward to seeing you all in Barcelona.
Brilliant. Thank you so much for that. So let's, as I say, let's stop the slides. So lots of, I'm sure, lots of questions or comments that flow from what we've shared. Do people want to perhaps type away those comments, or perhaps ask to be unmuted? Perhaps while you're doing that, can I just ask Annette, as we know, is one of our lead nurses, just to talk about how this is kind of shaping your own clinical practice and approach to managing your patients.
Yeah, thanks, Steve. I mean, I'm working a service up in the northeast of England, and I've been involved with the team now for 23 years. I mean, when I first started, we looked after 200 people with Parkinson's. We now have 1,700 people with Parkinson's. I cover a massive geographical area in England, and I cover 12 different clinics in different, locations. I mean, I remember the days where I used to have my boot full of information of Parkinson's leaflets, and I used to travel around and try and hand things out. But then often they would get out of date and they'd be crumpled and they wouldn't be right, and it wouldn't be in the right font or the format, and it'd be difficult. And then again, I would be in a different location and I wouldn't have the information for, certain other location that somebody was living in. So it's really difficult, I think, for us to try and keep up to date with what was going on in the local areas, how we support people better, and making sure the information is tailored for them and it's not just like a bulk buy. For diagnosis, I mean, it's the most difficult time, and as a nurse consultant, that's what I'm involved with in the team service. I'm involved with diagnosing Parkinson's, and it's such a difficult diagnosis to make, and it takes time and it takes care and it takes dedication for that, and talking about it in the right manner, in the right way. But for me, it's the time is the biggest issue, because there's so many things you're trying to get through in that half-an-hour consultation that you possibly can't cover everything that you want to. And particularly those really important things like information support, self-management, support for families, you know, even research and everything you want to talk about. It's really difficult to do at that point of time. In the NHS, yes, it's great to have that, but again, trying to get those appointments on a timely fashion is again very difficult. So you might see somebody and get diagnosed, but then it could be several months before you're seen again. And we do try and signpost people to Parkinson's UK at the very beginning, but then often we're relying on people to take up that offer that we give them and look at the information that we provide at the very beginning. For me, Parkinson's Connect has been fantastic because it's given that opportunity then to make that diagnosis, but then signpost people to Parkinson's UK at the very first steps, the very first appointment we have with them, and show the opportunities that there are to them to help support them on their journey. But just as importantly, it's about supporting those loved ones, family and friends that we've talked about. So making sure that everybody's included within that conversation, that we make sure that everybody gets the information they need at the very first point. So I've been really lucky to be a part of a pilot site for this project. We've been involved that for the last 12 months or so. It's been a bit difficult with COVID, as you can imagine, with clinics being cancelled and not being able to see people face to face. But again, when we started seeing people face to face again, we've been able to have those conversations. And even I've been doing lots of video consultations as well, even being able to offer at that point. So we've had a lot more people now taking up the technology that they never used to or never, had a look at. So again, it's opened up a lot more avenues for us. So I think it's given us a lot more confidence in our team and service about making sure that people get the right information at the right time, at the right level at diagnosis, and supporting them. And I think it's just great that we work, in partnership with Parkinson's UK, that we don't see as it's you or, us or them, that we work together, because we know that we've got massive challenges ahead. We know that year on year, our numbers of people with Parkinson's is going to go up. We know that our staffing levels are going down and there's pressure on that. So it's making sure that we all work together to make sure we meet the needs of people with Parkinson's and their loved ones. So for us, it's just a great opportunity to be part of, and it's been great to be there from the very beginning, really.
Brilliant, thanks, Annette, and your input has been really, really key to this. Polly, could you just talk perhaps a little bit more about that kind of initial point of referral at the point of diagnosis, what our approach has been towards that, and maybe what have been some of the challenges, I suppose. And there's been a couple of questions, I think one that perhaps didn't go to everybody, but more just thinking about just the almost the kind of governance type issues of exchanging data and all of those kind of processes. Just if you can sort of summarize that in a couple of minutes, that would be really helpful.
Yeah, sure. Thanks, Steve. So obviously the ambition to have this referral point embedded in the NHS across the UK was huge. And before we sort of go ahead and launch anything sort of UK wide, we really needed to get a good and sound understanding of how this would work and what the challenges that we were going to come across would be, so we could work through them. So our approach to this was very much starting small. So off the back of our discovery, where we collected a lot of insights, spoke to a lot of healthcare professionals and people with Parkinson's and their loved ones, we launched our new referral process into just 3 healthcare sites across the UK. And that's been a real learning process for us, because just by doing it in 3 sites means that we've learned how we're going to navigate governance processes, things like data sharing, agreements. We've got someone on the team who's our healthcare relationship manager, who has very close relationships with each of those 3 sites, and working really closely. And we've used the word kind of co-designing a lot, and as Annette was saying, this really has been hand in hand with the people on those sites. So yeah, as Steve was saying, there have inevitably been challenges. This is big, and governance processes will vary depending on kind of where you're going. We've learned a lot. We feel really confident the rate of referrals that are coming in is telling us that this is something that is going to work, that is scalable, and over the next kind of few months, we're going to be scaling and adding more sites on before we sort of do more of a UK-wide launch. So yeah.
Brilliant, thanks, Polly. And actually, if I can ask you the next one, Fabio has asked me about the integration platform to manage all of the services together. What's the state of the art? So I guess talking a little bit about the whole kind of approach towards account management, perhaps.
Yeah, sure. So we're just working through this at the moment. So we have our sort of a good sound understanding of what those user needs are and what the requirements for this platform is, and a number of things to kind of navigate here. You know, if we're talking about an account platform, will people log in? Is that going to be a barrier to them? So we've had lots over the past 16 months that we've tried to work through. We've done lots of user testing around this, and we have landed on a point there that if someone is online, that they will have an account that they can log into, or they will be making that as easy as possible for them to do so, and they'll be able to kind of view personalized and tailored content for them. But having said that, for people that are offline, that account still stands. So our advisors still have access to that. So our team of advisors that Katherine was talking about. So we can still provide for people that are offline a very personalized experience using technology. So whether that's recognizing the right point to make a phone call and check in with someone, or tailoring, you know, a letter or sending out a leaflet to someone. So that kind of on and offline integration has been really important, that this isn't a digital service, it's something that works for both. And we're just going through the process at the moment on sort of getting the technology to power this. So it's really exciting actually where we've landed with that. And yeah, very excited from a digital transformation point of view, the fact that we're using technology to be able to actually do this and make it a reality.
Brilliant, thanks so much. Katherine, do you want to talk a little bit more about kind of rollout, what you see as the kind of implementation timetable for this, you know, issues of launch? There were questions about how do people know about the service, perhaps if they've already been diagnosed, for example. Just some of your thoughts around, yeah, how we move this forward over the next few years.
Yeah, I'd be really glad to, and I can see a couple of those questions. And just to make it really clear, I did touch on it, but what Parkinson's Connect will offer is the charity's information and support offer, and a lot of that is already there. It will keep changing, developing, growing, I hope very much so over time, but it's there, so don't hesitate to get in touch. If you're living with Parkinson's in the UK, please do get in touch with us now through, use the website channels or phone our helpline.
Your first client ain't due for ages.
And that's there right now, so don't hesitate. We've got a really active forum with over 12,000 members. Join our community forum online. It's all there right now. For people living abroad who want to use some of the charity's resources, help yourself to the website. Please, it's there for everybody. Please use it. There's tons of fantastic content there right now, which you can use. And I think that takes us really neatly on to the next point. And as we see the rollout of this, there are two aspects in my mind. One is we've talked about quite a bit, is making sure that our personalized offer is right for everybody. Personalized is a real buzzword in charities, isn't it? We want everything to be personal to the person that uses it, that matches what a person's needs are. To make this rollout effective and taken up by people living with Parkinson's, we really want to make sure that we grow the number of people that are using our services so that we can keep building our knowledge and understanding of what's there. So we hope to grow that service from 50,000 people using it regularly a year to 150,000 to 300,000 people. If you imagine there's 145,000 people with Parkinson's in the UK, and each one, I hope, will have some sort of network around them, at least if one other person's in touch, that would be great. A key mechanism for doing that for us in the UK is that connection with the health professional. I really hope that every single person in the UK, and it would be fantastic to think worldwide, and I know it isn't the case everywhere, very quickly get support from a health professional. So for us, embedding that approach into the NHS is absolutely crucial. Polly's talked to some of the challenges that come with that, with making sure that data sharing agreements are right, that those aren't easy to overcome. And we've been really chuffed by the support we're getting from NHS colleagues and some of the funding we've attracted from one of the UK's 4 governments to help us to develop this work. And we want to use those tests and established evidence-based learning, which will help other organisations in the UK take up the offer and help to grow it. So that is a key driver for us. Because of the pandemic and the state of, I really hope, temporary upheaval the NHS is in, we know that's going to be a big ask for the NHS to really circle around and focus on us. So for us as a charity, we're thinking now about drawing in specific marketing and positioning expertise. I see that as being quite sophisticated. It's kind of marketing expertise who can focus on those health audiences. It'll be about growing our evidence-based profile, we hope through research journals, etc., and that more wider-based marketing. We hope that the digital tech space too will be a place where we can grow that offer. So it's going to be a multi-pronged approach. One bit working with the Parkinson's community, growing, sharing what we have to offer and drawing people to us, but really specifically focusing on that healthcare community and building and strengthening those partnerships.
Brilliant.
That helps.
So much
Thanks
for that. Yeah, no, that's really good. And a great question from Martha in Venezuela about how to kind of get started on this. I think maybe Polly and Yvette, whether you can have a stab at doing this. I mean, I think, you know, we've got to recognise that, you know, in the UK we're fortunate. We've been able to throw quite a lot of resource at this. We've got a lot of people working on it. But what would you recommend, Polly, to you know, maybe a small organisation that hasn't got lots of resources but just wants to get started in you know, meeting the needs of people? It'd be great to hear from you, Polly, and perhaps Yvette to add to that as well.
Yeah, I mean, I think you know, where we started was a vision and an ambition. So I think, you know, that can work whatever size of organisation you're within. So I think having that sort of senior leadership support to be able to kind of sort of set that ambition and vision from the start is crucial and a really good starting point. I think secondly, just whatever the size of resource or capacity that you might have, having that, giving people that kind of space to learn and time. So we started with a discovery, and for us that was quite big scale. We spent a lot of time doing in-depth interviews and ethnographies. A discovery might be that you're just starting with the data and a few conversations with people that you know, just to kind of get that basis understanding on what it is that you are aiming for and sort of feeding those needs into what you're doing. In many of the interviews that we did, we literally took a pen and a piece of paper and we were just sketching out people's ideas. We wanted to listen. Lots of people from the Parkinson's community had the best ideas on what they needed. So we made sure that we kind of captured them. So I think, yeah, starting there, starting with listening, starting with any data that you have, making sure that you have, you know, that kind of that vision, the ambition and the drive behind it, whatever resource you have. Yeah.
Yeah, brilliant. Thanks, Polly. So Yvette, I mean, Polly has talked there a lot about listening. What kind of advice, support, practical suggestions do you have around how best to listen to the Parkinson's community?
Well, really, one of the first things that we did was invited people to take part. And as Polly's mentioned, we did quite in-depth ethnographies, which basically is kind of shadowing people in their everyday life to pick up what, you know, what factors are important and, you know, what different people's needs were at different stages of having Parkinson's. So really it's about getting that involvement at the very start, and as Polly was saying, making sure that you've got all that data and it's built into whatever is going to be designed. And I know we had like a big blueprint from from point of diagnosis up until information that people might need along the journey. They actually mapped out what, the different stages where people might need more support. Also really make sure that what you're doing is inclusive, that you cover people from all different walks of life. As Katherine was saying, urban areas, rural areas, people who are on a low income. So you're not just designing for, for a stereotypical audience, really. It's about designing for everybody, and that includes things around accessibility as well, which is embedded in the service design process that we're taking.
Thanks, Yvette. That's really helpful.
If I can just, I think one of the things that we really tried to do in that first bit of discovery work was as Yvette was saying, speak to people from a whole diverse set of backgrounds and underserved communities, but also crucially people that hadn't engaged with Parkinson's UK before, hadn't used our services. Some of them hadn't even heard of us. So it was actually talking to them that really challenged our assumptions. We're an organisation with such a huge wealth of knowledge, an incredible workforce that work with people with Parkinson's all the time, but yeah, sort of speaking to people that might challenge our assumptions. So as Katherine touched on, this kind of distinct offer for family, friends and carers, and actually one of the kind of most impactful things I think that kind of came out of that initial piece of research was what is our offer for family, friends and carers, and how different their needs are going to be to the person living with Parkinson's. So yeah, that's reaching people that you don't, that you're not already in touch with is also a brilliant way to start.
Brilliant, thanks, Polly. And Annette, can I just ask you? I mean, you've talked a lot about almost sharing the care of your patients with the charity through kind of Parkinson's Connect. What is it that you need, I suppose, in terms of the confidence to do that? The confidence that we're not going to give people the wrong information or unrealistic expectations or the wrong emotional kind of support. What are you looking for to give you that kind of assurance?
You're right, Steve. I must admit, I had those conversations with the team in the early days because you feel very precious about the people that you look after. You're wanting to make sure it's right. And for us, because we don't discharge anybody, we look after everybody from diagnosis all the way through. So, I've looked after people for 20 odd years, and you build up relationships with them, and, you're part of their family as much as anything else. So for me, having worked with Parkinson's UK for so long, having known the staff, knowing the team, knowing the quality of the information, also being part of the team that helps to update information and resources, that's really helpful that we're working together as both NHS staff and yourselves to make sure the resources are appropriate, up to date, they're accurate. But having those conversations about where the boundaries are, what's right, what's not right, Steve. So I think those are issues why Polly said that we've got those 3 pilot sites. We're working out those things, we're checking out what works, and we're building up and developing it. I think for me it's still really early days, and we know we're going to go to next bit of testing next with increased number of sites, and the minute we've been focusing obviously on newly diagnosed people with Parkinson's. That gets more and more tricky, I think, as people become, further on in their journey with Parkinson's. You get more complex Parkinson's, and there's more difficult decisions potentially around, end of life and care and support. So it's just making sure that we're all talking together, and I think that's what we really need to make sure that we do, is that when we're all talking the same language. There's nothing that's misinformed for patients, that we're not giving mixed messages from Parkinson's UK to their healthcare providers. So for me, it's about working closely with you to make sure that this is right. And that's the great thing about this, is that we're working together, and that as things come up, we can deal with them and tackle them and make sure they are, still supporting people with Parkinson's as they need to.
Brilliant, thanks, Annette. And a great question from Joy about are we going to be encouraging self-tracking within the account. Is that something, Yvette, Polly, you're able to pick up? Is that in the short-term plans, or is it a longer-term vision?
You want me to? I'll take that one. It's yeah. So self-tracking itself isn't in the Parkinson's Connect account as such, and we know that there's you know, kind of technologies that people do use to do that. We are still, you know, in the early stages of designing, you know, what content is going to be in the account, what those triggers for personalization are going to be. Yeah, probably too early days at the moment to say whether something like that would be included. I mean, you know, I think it would potentially be a great thing for us to look at in the future. We're just at the moment starting on our kind of what we're calling our minimal viable product, which basically means the minimum that we're doing to kind of get it out and add value to people. So as we do this, we're still going to be learning what content to include, and of course anything that kind of meets needs and is useful will be stuff for us to consider.
Yeah, can I just add, I think that discovery phase as well, a lot of the research, a lot of people who we found out through the research that a lot of people do self-tracking, either through a diary or through a kind of like an app, but also through things like Laura Mishley's PD score, you know, scoring systems. And personally, I think that that's a really good idea because it's kind of makes you accountable, really. Yeah, so I would hope that would be part of the future of the service, integrated in terms of content in some way.
Yeah, fantastic. And a great question from Joe as well, who's wanting to kind of understand a bit more about our relationship with the NHS. I mean, I'll have a stab at this. I mean, we don't have a formal relationship with the NHS at all. We've developed strong links with healthcare teams, and as Katherine described, we kind of set up the Excellence Network, which is quite an informal network, really, of bringing health professionals together to enable them to work together to identify good practice and to be able to kind of disseminate that across the UK. And even with the referral kind of mechanisms, we're not tapping into NHS systems. It's a web page, and you know, very clear kind of protocols around doctors, nurses asking for consent before kind of referring through those web pages their patients into the charity. So, you know, it is quite a informal network of relationships, and you know, we do talk about the NHS as if it's, you know, the National Health Service. I mean, actually, you know, we were reflecting earlier as a team. In many ways, it is a network of different services, different providers. You know, it isn't about, you know, it's not like going to McDonald's and ordering a cheeseburger in London or Edinburgh and it being the same. You know, it is actually about kind of local design, local flexibility around services, and that's a challenge as to how we work with different providers. So yeah, I mean, the question, where do the neurologists fill in that service offer? I mean, it is in clinic. It's you know, I mean, the intention is that when people have that first consultation, they explain someone's got Parkinson's, that's when they would position Parkinson's Connect. You know, it will be followed up, I guess, through nurse appointments and others, but that's what the intention is.
Great question from Eli there. Has anybody said no so far? We don't want Parkinson's UK to provide support after.
Yeah, I'll answer this question because obviously I offer this when I see new people. I have had a couple of people saying no, but I think it's because it's such early days and it's such a shell shock, and they're just not, you know, they hadn't even thought about Parkinson's. It wasn't on their radar. They got the referral, and it's just been a massive shock to the system. And just people need time. And the thing for me is that this isn't a, you only get one chance of being referred in. This chance stays there, afterwards. So we follow that up again when we review them in next time round. And that's what the whole point is, that this service will grow and grow and grow, and more people will be able to access that. So yes, initially, but I think, diagnosis, as you'll all know, is such a different experience for many different people. For some, it can be a relief that actually, yes, there's finally a diagnosis that kind of takes into account all the symptoms they've been displaying. And yes, they want more information. You've already had people who've already been on the internet and Googled it and seen all the millions of hits, and just want to find a way of trying to find the right information that's accurate, they can read appropriately, and that's really clear for them, and they're desperate. And then this is just amazing. But I said there are a few people who just don't, think Parkinson's, don't, think they're definitely, don't think they've got it, even though they've had that referral in. And so it just takes a bit of time. And I think for everybody, it won't fit for everybody, but it's just about this being there, an opportunity that people can refer in themselves, as well as us as healthcare professionals. And the great thing for me is it's just a couple of clicks. All I have to do is, get that consent from the individual, both from the person with Parkinson's and their loved ones. I just put their first name in, and I put down either a telephone number or an email address, another click, and that's it, done. And I can do that from any computer system anywhere I work within the organization. I can do that on my, my tablet, on my phone. So it's a very, very quick, straightforward process of referring somebody in. There's not a lot of information I'm sharing. It's just first name and a contact detail.
Fantastic. Well, I'm conscious that we're coming up to the end, and we've had some great questions, but I think there's a really long thing that's got. I'll read that in a minute. While just asking the panel perhaps for a closing comment here. What would be great to hear from all of you? Just a sense of how you think the world will be different in 3 years' time. The work that you're doing, your world. And let's not make this kind of completely aspirational pipe dream stuff. Being realistic and practical. What are your hopes for this in 3 years time? Do you want to go first, Katherine, on this?
I think my role here at the Organise is kind of rooted in the practical, and because I've been a support worker, and actually for me, I'll talk about people living with more advanced Parkinson's. We've been able to provide a lot of support to people, but I know often when I've been working with families, I thought, oh, I wish you'd been in touch with us a year ago. We could have really helped you then, and your life might have been a lot easier. So for me, I'm really confident now that the way we'll develop our service offer and the way we'll build these partnerships with the NHS means that for many families living with Parkinson's, we will catch people at that point. Before what's really tough becomes an emergency. Sounds a wee bit aspirational, but I think when we track, and we're also fortunate, we've got quite a sophisticated case management system, and I can peer at the data and the stats. And I think as I'm tracking those statistics, as time goes on, I'll start to see those step changes, and we'll see an improvement in people's quality of life. And actually, to me, that feels quite real now, not just aspirational. So it's a bit evangelical, but I mean it. Yeah.
Brilliant. Thank you. What about you, Yvette?
For me, I mean, the title of the service says it all, really. It's Parkinson's Connect. And I would envisage that the future, the future of it will be about connecting people, not only to the right information and services, but with each other, for knowledge and learning about how to live well with Parkinson's. So really, I think that's the key thing for me, is the potential, the power that this has to connect people throughout the whole of their journey, not just newly diagnosed. I think that is going to be, really powerful.
Yeah, brilliant. Thank you. What about you, Polly?
I think I think for this one, if I sort of focus on the transformation that's happened here, and I think in 3 years' time, really, you know, that this will never be a project that's just done, and actually that this is just the start, and that we will continuously improve. We will continuously, and we'll be sort of leaving a legacy on you know, continually using data to drive the decisions and the directions of Parkinson's Connect, that will always be listening to users, that will still have that space to try new things and to innovate within Connect, and for it to be okay if that doesn't work, and we'll pivot onto other things. So yeah, I think that sort of in 3 years' time, that's where, you know, that's where I'd like this to be, is never done, and just continually striving for the next thing. Yeah.
Brilliant. Thanks, Polly. And what about you, Annette?
Yes, for me, it's definitely about working together. We've got lots of challenges ahead with us, with growing numbers of people with Parkinson's, complex condition, difficult symptoms to manage. And it's, you know, it's the whole community, isn't it, that's affected. It's not just the person with Parkinson's, it's the loved ones and everybody around them. So definitely what Yvette said about connecting each other, connecting together, working together, really. And this is just a fantastic way of doing that. And it gives us more confidence looking for the future as a team and a service, about make sure we get it right, and getting the right support, the right time to the right people.
Brilliant. Thank you so much. And yeah, so hopefully that's been really helpful for people. You know, I mean, I think the Parkinson's community is a fantastic international community that is great at sharing, and we'll be keen to, you know, share more. I think as things progress, I'm not sure if at this stage that there's masses that people can just pick up and use. But let's keep those conversations going, and you know, we'll be really happy over the years to share more of this. Can I hand back to Eli now, perhaps, just to.
Yeah, absolutely. Thank you so much to Steve and the whole team. I think this has been incredible. I have learned a lot. I'm so glad this came up in a conversation a number of months ago, Steve, and I know we bounced around the idea of how we could share this more broadly. And I think it's evident there are a lot of great questions. I was looking at the list of who joined us today. We do have friends from, and I know they're from all over, but Venezuela, Canada, Spain, Australia, UK, US, and other countries. I'm sorry if I missed your country, just where those are where I know people were dialing in from. And I think, one, we all want to see more of this, and where you go with this. You have done a huge lift and create an incredible service to just not just the community in the UK, but really the global community. People are going to be watching this, and I already got a couple of private messages of how can I do this in my country. So I think there's a lot of work, you know, as you evolve and you learn things and you have advice to give. I'd love to get back together again, maybe in a year down the road, or even a little bit longer, when you have some more data to share. And I do hope, I'll throw the challenge out there, I do hope that you're going to be submitting some abstracts to the WPC so that we can get some presentations about this. I think people will be very, very interested in not only this particular program, but sort of even the training, I mean, just multiple sort of aspects of it, possibly. So I want to say thank you so much for giving us time in your evening at home. Hopefully you can, you know, relax now. And I want to thank everyone for joining us. We will keep this recorded, this recording. We will share this link back out with everyone afterwards. So if you had to cut out early or you came in late, you can watch the rest of it. And we'll get that out to you shortly. And thank you everyone so much for joining. It's great to have you. And thanks to Parkinson's UK for such great work, a great program.
Thank you.
Thank you, Eli, and everyone for giving us the time.
Thank you.
It's been good. Thank you.
Thank you.